Good afternoon, Chris Vanderveen talking to you live from the 9 News newsroom. I'm joined, as always, around this time. We've been keeping it a little flexible. We apologize for that. With Dr. Kohli, we're talking about all things coronavirus. Obviously, we want to get to the news really fast that there was an update from the governor just a couple hours ago. The governor did something that I believe was expected. The governor declared a state of emergency in the state of Colorado. He has that power to do so. This is not unprecedented. It happens with other large-scale events in the state of Colorado. And in addition, there are now 15 positive cases of coronavirus in the state of Colorado, with the expectation, and the governor said that that number is going to increase, could increase rather substantially because they're going to be doing more testing. What is from a medical standpoint, when you hear state of emergency, what's the proper message?
I think the message is for a heightened level of caution. And again, as we've talked about before, the reason that we're more worried about this virus than we, are about the flu, for example, is because none of us have immunity to it. It's a new virus and it's an evolving and unknown situation. So I think what I heard from the governor today was that they're putting in resources to try to help physicians to do more testing and to try to detect more patients so that can help guide our prognosis, our treatment, and how we control the spread of the virus.
There was a lot of news that came in that governor's press conference this morning, talked about the idea that he wants employers in the state of Colorado to provide paid sick leave should somebody be waiting for results. If the state lab tested, it can be done in 48 hours. Now this is also news, is that private labs are coming online. LabCorp in the state of Colorado is coming online to do additional testing sort of from a private standpoint. Those can take upwards of 3 to 4 days. But while somebody's waiting for the results, the governor wants employers to have that message that, look, we have this expectation you're going to pay sick leave for these people because not everybody has sick leave. And the governor made a point of saying he doesn't want people showing up to work because they're worried about a paycheck.
Right. And I think that kind of drives home a point this is the behavior we should be practicing always. We should, when we're not feeling well, stay home from work because it's not the risk to you, but it's the risk to your coworkers. And we really got to start thinking with our community hats on now because it's not just us that's in it, it's our entire community.
I won't say her name, but there is a manager here at the station who I was talking to with a couple days ago. She had a fever and she shouldn't come to work. There is not a suspicion, I don't believe, that she has COVID-19. But I think now is a really good time for people to not just be showing up at work with a fever. I would imagine that's your recommendation as well, right?
Yeah, so fever absolutely should be a red flag, but even milder symptoms like cough, because sometimes people can develop a low-grade fever in the first week and then it progresses to a higher grade in the second week. So, in the first week, if you do have coronavirus, for example, you could have a very low-grade fever or have the muscle aches and pains before you start showing some of the other symptoms. So I would say even things like cough, of course, shortness of breath is a later symptom, but if you have that, certainly stay home.
Isn't a fever in general indicative of a person that could very well be contagious, whether it be COVID-19 or anything else?
Yeah, and we're in the respiratory virus season. And so most of these viruses are spread by droplets or direct contact. So if you have a fever, even if it's a low-grade fever, we talk about what's low-grade or what's high-grade, but regardless, you could have a different kind of a virus that could affect somebody else. So certainly, yes, any symptoms such as fever should really mandate you to stay home.
I think the other interesting news that came from the governor's press conference, and feel free to ask questions. We're going to try to get to them in a moment, but this is why I'm looking down right over here because that's where my phone is, and I can look up the questions that you're asking, is that the state now at their lab in Lowry, which is just in East Denver, they're going to have a drive-up testing capability. Now, this does not mean, it's really important to understand this, this does not mean that anybody who believes that they're sick can just simply show up at this facility and get a test. That's not how it's going to work. But if people have a doctor's note that asks for a test, they can then get a test. What is the importance, Dr. Kohli, of having mobile testing where you don't have to have somebody actually physically walk in a building?
I think it's one of the most brilliant things that they started in South Korea that we have now adopted. And the reason is because you're not sitting in a crowded waiting room with many other people who may be concerned that they have the infection waiting for a test. The other reason, of course, is that it increases accessibility. So if you're just sitting in the car, especially when you're not feeling well, the last thing you want to do is go and sit in a hospital waiting room. So it makes it much more likely that you're able to get the test. I will give one warning, which is that if you're feeling ill, you have to be careful who you put in the car with you.
Yeah.
Because if you have your, significant other or your spouse or your parent or your child drive you, that person is certainly significantly higher risk because they're sitting in a closed compartment with you.
We've made a point here in the newsroom that I think should be standard for journalism in general. I don't know if I've heard of it taking place, although it just seems like common knowledge. If somebody calls us and tells us that they're sick and they're waiting to get tested, they want to get tested, I'm also the director of reporting here at 9 News. I don't want my reporters going into a house or a room with somebody who suspects they may have COVID-19. It's just common sense. But what we also don't want to do is bring it into this building.
Right. Right.
That would be. I mean, what somebody did ask this, and maybe horrible segue, but somebody asked that there was a question about if somebody shows up, if in your workforce, in your office, who is positive, and they had lots of contact with people in that office. Do the other people have to get tested? Do they not? Or will they get tested?
So that's a really important question. So there hasn't been a consensus yet on, this is called a first degree contact. So someone who's had a direct contact who's not having symptoms. So that's a little bit of a question up in the air. And it's certainly if you're somebody who has been exposed to someone who tested positive, you need to talk to your doctor because the decision to test is really going to depend on your doctor. According to the state at this point, up until now, we've mainly been looking for symptoms and an exposure. So if you don't have symptoms, but just the exposure, you may not qualify. But more recently, as of a couple of days ago, the CDC has formally relaxed the criteria, as has the state. So you may certainly be somebody who could still qualify for a test. Now, we want to balance testing you too early, because if you've been exposed and infected, but the amount of viral particles that you have in your lungs are very low, your test may come back falsely negative. So you may actually be somebody who later goes on to develop the symptoms, but it's just too early in the course of the disease.
That makes it tricky, huh?
It really does.
I'm going to get to some of these questions. Travis, are they really closing the parade this weekend? Yes, that announcement just came out within the last hour. Do you see any stores closing? I'm looking at, and what about the schools? I'm getting the sense right now from a news perspective that right now the schools are not closing en masse. Nobody is wanting that to happen, and nobody expects that to happen in the immediate future. I think there's this idea, this knowledge that like large gatherings can be questionable, and I think everybody's going to have to sort of take that on an individual basis. When people come up and ask you, what's my level of concern where should my level of concern be as a parent when I've got children in school? I mean, my daughter's own school had 3 kids who were sick yesterday, who all came to school. And they had to go home. What's your advice there?
So I think parents need to feel pretty good because, as we've talked about before, the rate of infection in kids is quite low, and even the ones that get infected tend to have milder symptoms and fewer complications. But the reasons that schools become important is because there are parents that come to it, there are teachers that come to it, and certainly they can be vectors for spreading the infection. So at this point, what we really started focusing on, for the longest time, we had been talking about hand washing and covering your cough and sneeze, and those were individual level measures. In the last few days, we've shifted to a community approach. How can we as a community change our behaviors to stop the spread of the virus? The first and most obvious is the super spreading events is what we call it, which are these big gatherings. And that's some of the reason you're seeing the parade being closed off and some of the other events being canceled, some of the sporting events, because it's a whole bunch of people in close contact with one another for, a prolonged period of time. Now, some people argue that the contact is not quite enough to create spreading of the virus, but because there is a question and because some other outbreaks of this virus in other communities have occurred around these events, that's the reason they're being canceled. In terms of schools and casual contact like at work, certainly there's a potential for spread there as well. But because the burden of the virus is so low in our society at this time, in other words, we only have 15 positive cases, the likelihood that that's going to impose a significant risk at this point is low. But in a few weeks, that could change.
Corey, I have an immune deficiency. Would wearing a mask when I need to go out, like to work or food, help protect me?
With your immune deficiency, Corey, you're certainly significantly higher risk. As we've talked about before, the masks do not offer adequate protection against this virus. They only filter the large droplets, not the small droplets, so you could still be at risk. So my advice to you would be to try to get somebody to, go out for you and collect the things that they need to collect because you're one of those people who's significantly higher risk.
Okay, what I'm already noticing right now from the questions is that we're educating. People here are asking informed questions, which is a really good sign, by the way.
Yeah.
It's like
You know
we've
the
gone
facts
beyond the sort of the generalized questions, and now we're
Right.
getting specific, and I think that's super helpful for this.
Yeah.
Andrew asks, what is the most likely long-term spread of the virus? Is it likely that 50% of the population will eventually get it, more or less?
I'm not sure about the numbers there, Andrew, because different epidemiologists have modeled the virus behavior in different ways. And again, our behavior will influence where it ends up happening. But the CDC is now saying that they predict this virus will be here next year and that we'll be dealing with it for several years. So it's not something that's necessarily going to go away. But as more people get exposed and or a vaccine becomes available, hopefully some of us will have immunity to this.
Concerts? Jamie asks, concerts.
So Pearl Jam canceled their concert here in Colorado, and again, concerts similar to sporting events and other big gatherings could be a nidus for spreading the infection, could be a way to spread the infection, and so it's important, I think, for the time being to avoid it. Particularly if you're in the highest group of risk, as we've talked about, the older or the ones with chronic disease, but even the healthy ones, because the healthy people's behavior exposes that high risk group to risk. So even if you yourself are healthy, you could take the virus home to your parents, your grandparents, or other elderly people in your community and be spreading it around to them.
I think I brought this up with some management not too long ago. I think it's important, as we're talking about all this, is like every once in a while, we can all maybe collectively at home, take a deep breath.
Yeah.
Like we are all in this together.
We are.
There's a lot of unknowns. We're not, I swear, even though some people believe otherwise, I swear our intent is not to scare people. I live in this community. You live in this community. Mm-hmm. We have an interest of getting through this together in a way that keeps most people safe. Mm-hmm. And I think we have to look at things. 80% of people who get it have very low symptoms. Mm-hmm. We're not talking about widespread, but the things that we do now, the knowledge that we have now, look at it this way, the knowledge that we have now can actually make this better. Right?
It will. I mean, it'll empower your decisions, which will change how many people get it. So our behavior will change what happens in the future, and that I cannot emphasize enough.
I'm going to assume this person is joking, but I'm going to ask this question anyways because I think there becomes an issue of quarantine. There's going to be more and more people who are going to fall under quarantine orders, most likely this sort of self-quarantine idea. And we've already heard of instances around the country where people are not abiding by those quarantine. Even though a quarantine is certainly difficult, why is it important?
So first, I would just want to clarify the difference between isolation and quarantine. Mm-hmm. So isolation means somebody who has not been known to be exposed to the virus, but is being isolated. Mm-hmm. And quarantine is somebody who has had exposure to the virus, to somebody with the virus. And there's a voluntary quarantine where you do it to yourself, and then there's the mandatory where the order is issued. But if you're somebody who's been exposed to the virus, remember what I said, it could take up to 5 days on average before your symptoms start to show. And so for those first 5 days, you could be potentially infectious, meaning you could be spreading the infection to others and not have any symptoms yourself. And just think about the course of a single day, how many people you come into contact with, and multiply that times 5. And just imagine what would happen if you were exposed to the virus and got infected with the virus, but were not put under quarantine and allowed to kind of go about your business. The number of people that you would infect would be quite dramatic. So it's very important to follow quarantine orders for the sake of, again, the others in the community, because we're all in this together.
Kelly, I'm going to take this offline, but if you want to email me directly and get in contact with me directly, write this down. Chris, CHRIS at 9 news.com. Chris, CHRIS at 9 news.com. I'd be more than happy to have this conversation offline with you moving forward. Went to a store yesterday. They were saying there's already now enough supplies out there that the companies can't keep up. Should we worry and stock up?
So what the guidelines are recommending at this point is to have at least 2 weeks worth of supplies on hand at home. And the reason is, again, not because the supplies are going to run out necessarily, but more so because if we get to a situation where we're going to be isolating ourselves or we're going to be staying home, it's for social distancing purposes, it is important to have those supplies at home.
People with diabetes, type 1, type 2, at high risk?
Yeah. Type 1 probably a little higher than type 2 just because of the duration of diabetes, but at this point we don't have that data, so both at high risk.
Chemo treatment, seniors at risk.
Very high risk, yeah.
Swimming pools.
Bad idea. Somebody asked me yesterday about water aerobics for seniors. Under normal circumstances, I would say it's a great thing.
Wouldn't the chlorine kill it?
At the time, we don't know. But clearly you're going to come into contact with respiratory secretions when you're doing water aerobics, so you have to be careful.
A lot of schools in other states are moving to distance learning. In your professional opinion, should Colorado do the same?
I think that's a complicated question. I think probably at the present time we're not there yet, but in the next few days we may get there. And again, the reason is really because we're trying to slow the trajectory of the slope with which the viral count increases in our community. So right now we have 15 cases. If the cases start to go up relatively quickly and we get on that steeper part of the slope, then certainly the schools are one of the ways in which we can do social distancing.
I think what I heard from the governor today was that, and I think it's true, and I think you're hearing it from experts, so I'd be curious your thoughts on this, is that the next week or so is important.
Critical.
When we don't have a lot of cases in the state.
Right.
We don't want this thing to get out of control. We've
Right.
seen examples in Italy in particular
Right.
where they've closed off the country. We certainly don't want that happening here.
Right.
So is it really the point where when we're not seeing a lot of cases, this is a pivotal time, is it not?
We have a window, Chris. We have a window. I don't know how big the window is, if it's days or weeks, but before the cases really start to take off, when we can really change the behavior of what we're doing, of how we're interacting with each other, and stop the spread of this virus. And just to give you a little perspective, if our entire country went on lockdown today, meaning everybody got completely isolated and there was 100% compliance with that, in 2 weeks this epidemic would be over. Because the people who have the virus right now would finish their course and there would be no new infections. And so, of course, that's not a reasonable or realistic solution at this point that we can necessarily pursue, but I think it is important to keep that in mind when we talk about why we're doing some of the things that we're doing.
Somebody asked about recommended close HVAC vents in the room where someone is quarantined. I would think that would make sense, right?
So-
you don't want air spreading around areas.
So if you're in the hospital and you're under a quarantine, they put you in a negative pressure room, which means that the ventilation system is designed to prevent the spread of these particles. Now, if you're self-quarantined at home or you're quarantined at home, the HVAC system, as far as we know, doesn't necessarily need to be altered because the virus is not airborne, as far as we know. So there's a difference between respiratory droplets and airborne. Airborne means it can survive in the air for long, long distances, including in ventilation systems. Respiratory droplets means you have to have close contact less than 6 feet in order for those droplets from your mouth or lungs to get, in my nose or mouth.
We're getting a lot of questions about urgent cares and people showing up. I think one of the questions that I have is, when do you believe, because this is just a time of year where people get sick. We're still in that period where lots of people get sick with upper respiratory things that have nothing to do with this. At what point do you sort of press the pause button and say, maybe I do need to go to, maybe I do want to see a doctor. This is more serious. Because what you don't want to do, one, you don't want to show up randomly at a place right now. You just don't. You need to call ahead. But two, when do I know, as like Chris Vanderveen, that I need to sort of say, you know what, maybe I do need somebody to take a look at me. Because I think a lot of people, I described, people are showing up at urgent cares, they're asking for tests, doctors are not giving them tests because they don't fit the criteria. When do I say to myself, this is something I need to be worried about?
So I would say it's really the symptoms, the ones that you have, and the severity of the ones that you have. So if you have a fever, cough, and shortness of breath, those are the three main symptoms to remember. And the one that I particularly worry about that sets this one apart from the flu and from the cold is shortness of breath. Because when you have a cold, you feel under the weather, you're a little stuffed up, you feel fatigued or malaised, but you're not short of breath. And if
That's a bad sign. That's a cue.
That is a huge red flag. But my only concern is, and the caution I want to tell our viewers is that don't necessarily wait for that. If things are getting worse, you look like you're headed on a trajectory where you're not getting better, you're getting worse, because this virus, remember we said has an incubation period of 2 to 14 days. So the course of it is a little bit longer than a cold would be, which is just a couple of days. So if a couple of days have gone by and you feel like things are still bad, before even you develop shortness of breath, it may not be a bad idea to check in. But the really big red flag is shortness of breath.
Should we? Here's a question for me. 'Cause I'm actually going to the doctor in not a long period of time for something totally unrelated to a cold or anything. I just have a back issue. Do people need to be worried about going to medical facilities right now? And let me put this one caveat, because I know this is taking place. A number of facilities are starting to ramp up plans for how people enter their buildings.
Yeah.
Hospitals are doing that. We talked with Kaiser yesterday. They have a facility down in Lone Tree where they're doing that drive up. For patients, again, who get approval from doctors to get tested. They're also greeting people at the door because what they don't want people is to go into their system. So what's the advice for people showing up in medical facilities right now?
I think at this point it's safe, and we wouldn't say that unless we know that the medical providers are really informed about those types of things. So I don't want you to be fearful of going to your doctor. Having said that, again, if you're going for suspected coronavirus or COVID screening, make sure that you call ahead first, because they need to know and be prepared so that they're ready for you, and so that they're making sure that the other visitors to their facility are also safe as you're visiting the facility.
I do want to address this issue because I am curious your thoughts in terms of the media now being the enemy here. Hopefully you've been watching this, and we're not freaking out. We're not talking to you breathlessly. We're having a conversation with you about information that we believe is helpful for you to make your own personal decisions in your own personal lives. But clearly there is a concern out there. And it's causing people to do some pretty crazy things from time to time, like buy an irrational amount of toilet paper, for example. What do you think is our role here in terms of distribution of the information? And where do you think that we can go too far?
So I think certainly anything has the potential for us to go too far, but I will say, I've said this before and I'm going to say it again, information is power. At this point, one of the best things that we have to fight this virus is information about how it spreads, what it is, where it's going, and what its behavior is doing. And so the goal of this extensive coverage that we're offering is not meant to scare people, but it's meant to empower people to have the information so that when and if they encounter this virus or it starts to affect them and their family members, they have the knowledge of what it's been doing. So again, don't be scared. It's your emotional reaction to the information that really controls the way that you behave. And if you look at this as information, just like you might hear news about current events or the Olympics or President Trump, think of it as another piece of information rather than setting off an alarm bell in your head, because that's really the emotional reaction to the information that's driving that fear.
I can assure you, this is a daily conversation in this newsroom we are having about how far and how much we want to cover that day, because we deliberately don't. It's not our intent. People are not going to believe when I say this, but it is not my intent. It's not your intent. I don't believe there's anyone's intent in this newsroom to scare people, but we do believe in that idea of information is power, and that helps people make decisions. I have, somebody said, you say shortness of breath is a symptom. Asthmatics can get that with a bad cold.
They can. Right? They can, and asthmatics are higher risk. So if you're asthmatic and you're short of breath, you need to call your doctor, regardless of whether it's about coronavirus or just talking about your asthma, but it's important to check in.
Dr. Kohli, once again, thank you so much for this information.
Thank you.
I'm going to go to my doctor now and stay safe. But thanks for all this information. I'll repeat it one more time. Chris at 9news.com. If anybody has any thoughts, opinions, any criticisms that they want to share, Chris at 9news.com. I'm more than happy to address your individual concerns, specific concerns. What I don't want to hear is people saying the media stinks. What in there do we stink? Why do we stink? What is in there that we're doing wrong? I like to hear that, because then it can help us frame our coverage better moving forward. And that's our goal because like we say, it's going to be a theme of these updates. We're all in this together. So thanks, Dr. Kohli.
Thank you.